Chapter 36, Spiritual Health. The word spirituality comes from the Latin word spiritus, which refers to breath or wind. The spirit gives life to a person. It signifies whatever is at the center of all aspects of a person's life. Today, spirituality is often defined as an awareness of one's inner self and a sense of connection to a higher being, nature, or some purpose greater than oneself. A person's health depends on a balance of physical, psychological, sociological, cultural, developmental, and spiritual factors. Spirituality helps individuals achieve the balance needed to maintain health and well-being and cope with illness. The concepts of spirituality and religion are often interchanged, but spirituality is a much broader and more unifying concept than religion. Nurses need to be aware of their own spirituality to provide appropriate and relevant spiritual care to others. They need to care for the whole person and accept a patient's beliefs and experiences. Being able to determine the importance that spirituality holds for patients depends on your ability to develop caring relationships. Scientific knowledge base. Spirituality is an important factor that helps individuals achieve the balance needed to maintain health and well-being, and to cope with illness. It is a belief that mind, body, and spirit are interrelated. Beneficial health outcomes occur when individuals are able to exercise their spiritual beliefs. Healing often takes place because of believing. Research shows that spirituality positively affects and enhances physical and psychological health, quality of life, health promotion behaviors, and disease prevention activities. Many of the beneficial effects of spirituality are tied to hormonal and neurological function. Integrative body-mind techniques that include relaxation, guided imagery, mindfulness training, and music reduce perceptions of pain and anxiety. Nurses should embrace the idea that beliefs and convictions are powerful resources for healing. Case study. Victoria Timms is a 48-year-old African-American college professor, diagnosed 3 months ago with breast cancer. She is married to Joe, an insurance salesman, and is the mother of 2 children, Valerie, 16 years, and Peter, 12 years. Surgeons removed Victoria's cancerous tumor and 2 involved lymph nodes. Because of the lymphatic involvement, Victoria is at increased risk for the cancer to spread. Victoria describes her family as being very close and supportive. How important do you think it is for the nurse to have a discussion with Victoria about her spirituality and beliefs? Frequently, spirituality and religion are interchanged, but spirituality is a much broader and more unifying concept than religion. Spirituality is a complex concept that is unique to each individual. It depends on a person's culture, development, life experiences, beliefs, and ideas about life. It is an inherent human characteristic that exists in all people, regardless of their religious beliefs. Because it is subjective, multidimensional, and personal, researchers and scholars cannot agree on a universal definition of spirituality, shown as Figure 36-1. The concept of spirituality has 5 distinct, but overlapping constructs that are used to define spirituality. Self-transcendence is a sense of authentically connecting to one's inner self. It is a positive force. It allows people to have new experiences and develop new perspectives that are beyond ordinary physical boundaries. Examples of transcendent moments include the feeling of awe when holding a new baby or looking at a beautiful sunset. Connectedness is being intrapersonally connected within oneself, interpersonally connected with others and the environment, and transpersonally connected with God, or an unseen higher power. Through connectedness, patients move beyond the stressors of everyday life and find comfort, faith, hope, and empowerment. Faith allows people to affirm beliefs despite lack of physical evidence. It enables them to believe in and establish transpersonal connections. Although many people associate faith with religious beliefs, it exists without them. Hope has several meanings that vary on the basis of how it is being experienced. It usually refers to an energizing source that has an orientation to future goals and outcomes. Spirituality gives people the ability to find a dynamic and creative sense of inner strength to be used when making difficult decisions. Inner peace fosters calm, positive, and peaceful feelings despite life experiences of chaos, fear, and uncertainty. Spirituality also helps people find meaning and purpose in life in both positive and negative life events. Some people do not believe in the existence of God, called atheism, or they believe that there is no known ultimate reality, known as agnostic. Nonetheless, spirituality is important regardless of a person's religious beliefs. The concept of spiritual well-being has two dimensions. One dimension supports the transcendent relationship between a person and God, or a higher power. The other dimension describes positive relationships and connections that people have with others. In addition to being a component of spirituality, the concept of faith has other definitions. It is a cultural or institutional religion such as Judaism, Buddhism, Islam, or Christianity. It is also a relationship with a divinity, higher power, or spirit that incorporates a reasoning faith and a trusting faith. Reasoning faith provides confidence in something for which there is no proof. Religion is associated with a state of doing, or a specific system of practices associated with a particular denomination, sect, or form of worship. It is a system of organized beliefs and worship that a person practices to outwardly express spirituality. When providing spiritual care, it is important to understand the differences between religion and spirituality. A spiritual person's faith brings hope. When a person has the attitude of something to live for and look forward to, hope is present. It is a valuable personal resource whenever someone is facing a loss or a difficult challenge. Case study continued. Victoria has completed a course of radiation and now visits the cancer clinic with her husband 3 times a week for chemotherapy. Victoria and Joe discuss their concern for their children. Valerie and Peter attend Sunday school weekly after going to church with their parents. Their Sunday school teacher informed Victoria and Joe that Valerie and Peter are very angry about their mother's illness. Jeff is a 36-year-old married student nurse assigned to the oncology clinic. He is in his last semester at school and hopes to get a position in the clinic after graduation. Jeff is assigned to follow Victoria during her visits. Victoria's experience is significant for Jeff because he has children who are the same age as Victoria's, and he wonders how his children would react if his spouse became ill. Do you think Jeff's assignment to care for Victoria will, or will not, affect his desire to work at the clinic? Care. Religious versus spiritual. Religious care helps patients maintain faithfulness to their belief system and worship practices. Spiritual care helps people identify meaning and purpose in life, look beyond the present, and maintain personal relations as well as a relationship with a higher being or life force. How you provide care will be affected by your patient's religion and spirituality. Please review Table 36-1, Religious Beliefs about Health, as a supplement to this PowerPoint. Spiritual health. People gain spirituality by finding a balance between their values, goals, and beliefs, and their relationships within themselves and with others. In times of stress, illness, loss, or recovery, A person often uses previous ways of responding or adjusting to a situation. Beliefs among older people vary based on many factors, such as gender, past experiences, religion, economic status, and ethnic background. As children mature into adulthood, they experience spiritual growth by entering into lifelong relationships with people who share similar values and beliefs. Beliefs among older people vary on the basis of cultural factors such as gender, past experience, religion, ethnicity, and economic status. Factors influencing spirituality. When illness, loss, grief, or a major life change occurs, people either use spiritual resources to help them cope, or spiritual needs and concerns develop. Spiritual distress is a state of suffering related to the impaired ability to experience meaning in life through connections with self, others, the world, or a superior being. Spiritual distress causes a person to feel doubt, loss of faith, and a sense of being alone or abandoned. Individuals often question their spiritual values, raising questions about their way of life, purpose for living, and source of meaning. Spiritual distress also occurs when conflict arises between a person's beliefs and prescribed health regimens or inability to practice usual rituals. It causes people to question their identity and feel doubt, loss of faith, and a sense of being alone or abandoned. Individuals often question their spiritual values, raising questions about their way of life, purpose for living, and source of meaning. Sudden, unexpected illness often creates spiritual distress. People often look for ways to remain faithful to their beliefs and value systems. Nurses use knowledge of a person's spiritual well-being and implement spiritual interventions to maximize inner peace and healing. Many chronic illnesses threaten a person's independence, causing fear, anxiety, and spiritual distress. Dependence on others for routine self-care needs often creates feelings of powerlessness. Terminal illness causes fears of physical pain, isolation, the unknown, and dying. It creates an uncertainty about what death means, making patients susceptible to spiritual distress. Some patients have a spiritual sense of peace that enables them to face death without fear. When caring for dying patients, help them gain a greater sense of control over their illness, whether they are in a healthcare setting. Dying is a holistic process encompassing a patient's physical, social, psychological, and spiritual health. Some nurses care for patients who have had a near-death experience. A near-death experience is a psychological phenomenon of people who either have been close to clinical death or have recovered after being declared dead. Commonly, patients who experience a near-death experience describe feeling totally at peace, having an out-of-body experience, being pulled into a dark tunnel, seeing bright lights, and meeting people who preceded them in death. Patients who have a near-death experiences are often reluctant to discuss it, thinking family or caregivers will not understand. Isolation and depression often occur. Aftercare for a patient who has survived a near-death experience includes promoting spiritual well-being by remaining open, giving patients a chance to explore what happened, and supporting them as they share the experience with significant others. Please review Box 36-1, Evidence-Based Practice, Spirituality and Chronic Illness, as a supplement to this PowerPoint. Case study continued. During one of their clinic visits, Victoria and Joe appear very calm and relaxed when discussing the cancer therapy. Joe explains, "We both have a lot of faith in God." Victoria responds, "Even though I know I have cancer, I hope to be able to continue to go to church with my family and my children. My family is very supportive, and together, I know we will make it through this experience. But I am worried about my children. With God's help, I can help them cope with my illness better." Jeff, the student nurse, should continue to encourage Victoria and Joe to openly discuss how they feel in an effort to promote spiritual well-being. Successful critical thinking requires a synthesis of knowledge, experience, information gathered from patients, critical thinking attitudes, and intellectual and professional standards. Clinical judgments require you to anticipate information, analyze the data, and make decisions regarding your patient's care. While using the nursing process, apply critical thinking in providing appropriate spiritual care. The helping role is important in nursing practice. Patients look to nurses for help that is different than the help they seek from other healthcare professionals. Nurses who are comfortable with their own spirituality often are more likely to care for their patients' spiritual needs. After becoming comfortable with your own spirituality, use your nursing knowledge to anticipate your patient's personal issues and the resulting effect on spiritual well-being. When you integrate patient preferences, values, and beliefs into spiritual care, you provide patient-centered care with sensitivity and respect for the diversity of human experience. You need to determine if your spirituality is beneficial in assisting patients. Use critical thinking when assessing each patient's reaction to illness and loss and determining if spiritual intervention is necessary. You demonstrate integrity by refraining from voicing your opinions about religion or spirituality when your beliefs conflict with those of your patients. In setting standards for quality health care, the Joint Commission requires healthcare organizations to assess patients' denomination, beliefs, and spiritual practices and acknowledge their rights to spiritual care. The American Nurses Association Code of Ethics for Nurses requires nurses to practice nursing with compassion and respect for the inherent dignity, worth, and uniqueness of every person. Determine which interventions are compatible with your patient's beliefs and values before selecting them. Case study continued. Jeff recognizes that Victoria shows acceptance of her disease because she is able to discuss cancer in the plan for treatment. Jeff knows that as patients begin to accept the fact of being diagnosed with a life-threatening disease, it is important to offer opportunities to share feelings and to begin to provide time to discuss future plans. Jeff's previous experiences with cancer patients have taught him that when patients express hope, they seem to be able to move forward and cope with the challenges of their disease. Jeff recognizes that Joe usually comes to the clinic, and Victoria describes him as a strong source of support. However, Jeff does not know enough about the couple's relationship and wants to explore this further. The role of family members in providing support, particularly with regard to decision-making, is important for Jeff to understand before he develops a plan of care. Jeff should encourage Victoria to elaborate more on her husband, in an effort to better evaluate her support system. Time for a quick quiz. When caring for patients, the nurse must understand the difference between religion and spirituality. Religious care helps individuals a. Maintain their belief systems and worship practices, b. Develop a relationship with a higher being, c. Establish a cultural connectedness with the purpose of life, or d. Achieve the balance needed to maintain health and well-being. The answer is a. Maintain their belief systems and worship practices. Religion is associated with a state of doing, or a specific system of practices associated with a particular denomination, sect, or form of worship. It is a system of organized beliefs and worship that a person practices to outwardly express spirituality. Religious care helps patients maintain their faithfulness to their belief systems and worship practices. Spiritual care helps people identify meaning and purpose in life, look beyond the present, and maintain personal relationships and a relationship with a higher being or life force. Case study continued. Jeff discovers that spiritual needs are often associated with cultural beliefs. Spiritual and cultural beliefs affect how patients of different cultures experience health and illness. Spirituality often provides a source of healing, coping, and peace. Jeff uses this understanding to develop a culturally competent plan of care for Victoria and her family. Jeff learns that Victoria's church has a parish nurse. What steps could Jeff take next? Jeff talks with Victoria about the services her parish nurse provides. With Victoria's permission, he shares her health problems and concerns with the parish nurse, who agrees to contact Victoria and arrange a time for them to meet. Jeff is a Lutheran and does not know very much about the Baptist faith, the couple's religion. However, he knows that the Baptist sense of community is very strong and that it is important to learn more about how the members of the Tim's church play a role in offering support to the family. Jeff recognizes that spiritual well-being is more complex than religion. He encourages Victoria and her family to strengthen their spiritual health as they continue to cope with Victoria's breast cancer diagnosis and treatment. What other things might Jeff do to help this couple? Additional measures Jeff could take include encouraging Joe to attend church even if Victoria is too ill to attend, contacting the Tim's pastor and arranging times for people from the church to come sit with Victoria for a few hours 2 days a week to allow Joe some time to take care of himself, praying with Victoria and Joe during their visits to the oncology clinic and encouraging them to continue to read the Bible together at home, reflecting on his own value and belief systems so that he will remain open and receptive to understanding Victoria and Joe's spiritual belief systems. By understanding his own beliefs, Jeff will be better able to help Victoria and Joe cope with her diagnosis. Nursing process, assessment, understanding a patient's spirituality, and then appropriately identifying the level of support and resources needed, requires a broad perspective and an open mind. As a nurse, you make a commitment to meet the spiritual needs of your patients. Thus, it is essential to respect each patient's personal beliefs. People experience the world and find meaning in life differently. Spiritual assessment is therapeutic because it expresses a level of caring and support. It is essential to take the time to assess a patient's viewpoints and establish a trusting relationship. Establish trust and rapport and make the opportunity to conduct meaningful discussions with patients a priority. Focus your assessment on aspects of spirituality most likely to be influenced by life experiences, events, and questions in the case of illness and hospitalization. Listening to a patient's story is an essential method for obtaining a spiritual assessment. Asking direct questions requires you to feel comfortable asking others about their spirituality. For example, the nurse should use the Spiritual Well-Being Scale, which has 20 questions that assess a patient's relationship with God, and his or her sense of life purpose and life satisfaction. The FICA assessment tool evaluates spirituality and is closely correlated to quality of life. FICA stands for the following criteria: faith or belief, importance and influence, community, and address. When you understand the overall approach to spiritual assessment, you are able to enter into thoughtful discussions with patients, gain a greater awareness of the personal resources they bring to a situation, and incorporate the resources into an effective plan of care. Please review Box 36-2, Nursing Assessment Questions, and Figure 36-2. critical thinking model for spiritual health assessment, as a supplement to this PowerPoint. Assess the source of authority and guidance that patients use in life to choose and act on their faith and beliefs. Determine if a patient has a religious source of guidance that conflicts with medical treatment plans, and affects the option that nurses and other healthcare providers are able to offer patients, shown as Figure 36-3. Praying or reading a Bible together enhances the connectedness between parents and their children. Please review Box 36-3, Cultural Aspects of Care, Spirituality and Culture, as a supplement to this PowerPoint. Spiritual well-being includes life and self-responsibility. Individuals who accept change in life, make decisions about their lives, and are able to forgive others in times of difficulty have a higher level of spiritual well-being. People who are connected to themselves, others, nature, God, or another supreme being, cope with the stress brought on by crisis and chronic illness. One way patients remain connected with their God is by praying. Spiritual well-being is tied to a person's satisfaction with life and what he or she has accomplished. Even in the case of children, when people are satisfied with life and how they are using their abilities, more energy is available to deal with new difficulties and resolve problems. Spirituality is a personal experience within a cultural context. It is important to know a patient's cultural background and assess his or her values about the healthcare problem and impending treatment. Explore the extent and nature of a person's support networks and their relationship with the patient. It is unwise to assume that a given network offers the kind of support that a patient desires. Assessing the use of rituals and practices helps you understand a patient's spirituality. Rituals include participation in worship, prayer, sacraments such as baptism or Holy Eucharist, fasting, singing, meditating, scripture reading, and making offerings or sacrifices. If rituals are important to a patient, use them as part of nursing intervention. Individuals express their spirituality on a daily basis in life routines, work, play, and relationships. It is often a part of a person's identity and vocation. When illness or loss prevents patients from expressing their spirituality, understand the psychological, social, and spiritual implications and provide appropriate guidance and support. Nursing process, diagnosis. Exploring the patient's spirituality sometimes reveals responses to health problems that require nursing intervention, or the existence of a strong set of resources that allow the patient to cope effectively. Analyze data to find risk factors, or patterns of defining characteristics, and select appropriate nursing diagnoses. Accurate selection of diagnoses requires critical thinking. Review and analyze all concrete data such as religious rituals and sources of fellowship, your assessment of previous patient experiences, your own spirituality, and your appraisal of the patient's spiritual well-being. Commonly, patients have multiple nursing diagnoses. Several potential diagnoses are listed on this slide. Please review Box 36-4, Nursing Diagnostic Process. Readiness for enhanced spiritual well-being, as a supplement to this PowerPoint. Case study continued. Jeff knows that current evidence shows many African American women use spirituality to cope with breast cancer, so he decides to assess Victoria's spirituality in these three areas. 1. Victoria's connections with herself. 2. Victoria's connections with her family and significant others. And 3. Victoria's connections with a power greater than herself. Victoria has been told that her prognosis is promising, although she will need treatment to prevent spread of her disease. Jeff discovers that Victoria wishes she had more hope about her prognosis. Also, members of their church have offered support by taking Victoria to the clinic when Joe is unable. Victoria expresses a connection with her God when she states, "I do not feel alone. God is with me." Nursing process. Planning. During the planning step of the nursing process, develop a plan of care for each of the patient's nursing diagnoses. Critical thinking at this step is important because you reflect on previous experiences and apply knowledge and critical thinking attitudes and standards in selecting the most appropriate nursing interventions. Use a concept map to organize patient care and show how the patient's medical diagnosis, assessment data, and nursing diagnoses are interrelated. Confidence, an important critical thinking attitude, builds trust, enabling you and a patient to enter into a healing relationship together. Because spiritual care is so personal, standards of autonomy and self-determination are critical in supporting the patient's decisions about the plan of care. It is very important to collaborate closely with patients when setting goals for spiritual support and growth and choosing related interventions. In establishing a plan of care, goals and associated outcomes should follow. For example, the patient will improve personal harmony and connections with members of his or her support system. Outcomes include: the patient expresses an acceptance of illness. The patient reports the ability to rely on family members for support, and the patient initiates social interactions with family and friends. When establishing a mutually agreed on plan with the patient, he or she is able to identify what is most important. Spiritual priorities do not need to be sacrificed for physical care priorities. If a patient participates in a formal religion, involve members of the clergy or church, temple, mosque, or synagogue in the plan of care when appropriate. The nurse should also involve family and significant others. Please review Figure 36-4, Critical Thinking Model for Spiritual Health Planning, and Figure 36-5, Concept Map for Lisa Owens, as a supplement to this PowerPoint. Case study continued. Victoria expresses that her children, who are very close to their parents and share their faith in God, are not coping well with Victoria's illness. Jeff should now suggest goals and outcomes to assist Victoria and her family. Potential goals include the following. Victoria will restore connectedness with children within 2 months, and Victoria will remain connected with herself, her husband, and God within 1 month. Potential expected outcomes for the above goals include: in 2 weeks, Victoria, Joe, and children will discuss patient's beliefs about the future and her hope of having the cancer cured. In 4 weeks, Victoria will report sons and daughters' ability to discuss fears with mother, and by the end of this week, Victoria will make a formal time in her day to pray with family members. Nursing process, implementation. Establish caring relationships with patients to discover their beliefs about the meaning of illness or loss and the effects on the meaning and purpose of their lives. This level of understanding enables you to deliver care in a sensitive, creative, and appropriate manner. Nurses contribute to a sense of well-being and provide hope for recovery when they spend time with their patients. Show your caring presence by listening to patients' concerns and willingly involving family in discussions about patients' health. Encouraging words of support and a calm, decisive approach establish a presence that builds trust and well-being. To support a healing relationship, look beyond isolated patient problems and recognize the broader picture of a patient's holistic need. The nurse should assist in finding an interpretation or understanding of the illness, pain, anxiety, or other stressful emotion that is acceptable to the patient, as well as help the patient use social, emotional, and spiritual resources. Mobilizing a patient's hope is central to a healing relationship. Hope motivates people with strategies to face challenges in life. To help patients achieve hope, work together to find an explanation for their situation that is acceptable to them. It is always important for patients to be able to express and exercise their beliefs and find spiritual comfort. Having a clear sense of what illness will be like for an individual helps the person apply all resources toward recovery. In acute care, display soothing presence and supportive touch. Support systems provide patients with greatest sense of well-being and serve as a human link, connecting patient, nurse, and patient's lifestyle before an illness. Family, friends, and pastoral care are sources of faith and hope. Connectedness and fellowship with other persons are a source of hope for a patient. Part of a patient's caregiving environment is the regular presence of family, friends, and spiritual advisors. Diet therapies, foods and rituals are often an integral part of patients' beliefs on spirituality. Consult with a dietitian to integrate patients' dietary preferences into daily care. Supporting rituals may include clergy visits, prayer, meditations, and music. Plan care to allow time for religious readings, spiritual visitations, or attendance at religious services. Supporting spiritual rituals is especially important for older adults. In restorative and continuing care, prayer can be an opportunity to renew personal faith and belief in a higher being. Prayer is an effective coping resource for physical and psychological symptoms. Meditation creates a relaxation response to reduce daily stress. Patients who experience terminal illness or who have suffered permanent loss of body function require a nurse's support in grieving and coping with their loss. Your ability to enter into a caring, therapeutic, and spiritual relationship with patients supports them during times of grief. Please review Table 36-2, Religious Dietary Regulations Affecting Healthcare, Box 36-5. Focus on older adults, spirituality and spiritual health, and Box 36-6, Patient Teaching, Meditation Techniques, as a supplement to this PowerPoint. Case study continued. Jeff knows that spiritual support is important. He uses therapeutic communication to establish presence and trust, and to demonstrate empathy. He also prays with Victoria and her family, and encourages their religious practices. Jeff also tries to promote family integrity by identifying the family coping mechanisms and by encouraging Joe to communicate frequently and openly with Victoria. Establishing rapport, active listening, and trust are necessary when caring for people with spiritual needs. When people pray, they recognize the importance of their relationships with others and experience enhanced connectedness. Diagnosis of cancer causes the entire family to grieve. Discussing coping mechanisms used in the past helps children cope with illness. Nursing process. Evaluation. Ask the patient if you and the healthcare team met the patient's expectations and if there is anything else you can do to enhance the patient's spiritual well-being or enable the patient to practice important religious rituals. Evaluate ethical concerns that arise in the course of the patient's spiritual care and support. Apply critical thinking attitudes and use therapeutic communication techniques to ensure sound nursing judgments. Attaining spiritual health is a lifelong goal. In evaluating outcomes, compare the patient's level of spiritual health with the behaviors and perceptions noted in the nursing assessment. Evaluation data related to spiritual health are usually subjective. When outcomes are not met, ask questions to determine appropriate continuing care. Please review Figure 36-6, Critical Thinking Model for Spiritual Health Evaluation, as a supplement to this PowerPoint. Victoria shares with Jeff that the chemotherapy is making her tired much of the time. This makes it difficult for her to make time to get everything done and spend time with her children. She is worried that this may be part of why they are having difficulty coping. She asks Jeff for advice. In order to develop a plan to help Victoria, Jeff should do the following. Ask Victoria about her daily routine. Determine whether her routine includes time for prayer with the family, and ask Victoria and Joe about their relationship with each other and their children. Time for a quick quiz to assess, evaluate, and support a patient's spirituality. The best action a nurse can take is to A. Assist the patient to use faith to get well. B. Refer the patient to the healthcare facility chaplain. C. Provide the patient with a variety of religious literature. Or D. Determine the patient's perceptions and belief system. The answer is D. Determine the patient's perceptions and belief system. By understanding the patient's perceptions and belief system, the nurse is able to provide patient-centered care for the patient. Case study continued. In an effort to evaluate whether the clinic has met Victoria's expectations, Jeff asks, "Your faith is strong, and it is my hope that you have felt comfortable in talking about your worries. Do you believe we have helped you so far with your concerns?" Victoria replies, "The best thing you have done is listen and recognize how important my family is to me. Your suggestions have helped, and I am truly blessed to have met all of you nice people here."